I want to talk to you briefly about the TEED scale. And this is a question I get frequently from technicians and physicians across the United States. The TEED scale is a way that we judge the effects of pressure on the tympanic membrane. There's a lot of confusion. If I took my otoscope down to the airport and I looked in everyone's ears after they landed, I'd find a lot of TEED1 and TEED2 changes in the tympanic membrane. And that confuses people. After your hyperbaric treatment, if you look in the patient's ears, you're going to see a lot of TEED1 and TEED2 changes to the tympanic membrane. You can see the vessels that are present in the tympanic membrane. That usually goes away within 24 hours. The patient comes back in the next day for hyperbaric oxygen therapy. You look in the ears and it's gone. That is the body's natural reaction to pressure changes, TEED1 and TEED2. And for the most part in the hyperbaric suite, we don't need to worry about TEED1 and TEED2. When do you worry? When you get above that. TEED3, and I've seen a lot of TEED3 in my days, and what you typically see is a little bit of blood behind the tympanic membrane and it has bubbles in it. It's not every time that it'll have bubbles in it, but it's really frequent. You're not going to see that many TEED3s, so it's just something to keep in mind. But when you get above TEED2, that's significant. A TEED3 patient, I will typically give them 48 to 72 hours off of treatment. Give them a little holiday from the treatment to allow it to resolve. If it resolves, you continue treatment. If it doesn't resolve, then a referral to the ENT physician is indicated. TEED4, obviously TEED5, those patients need to be seen by the ENT physician before continuing on with their treatment. If you have questions, don't ever hesitate to contact me.